Out of 12% of the population, 12% are Black moms, but we're still dying at a rate of 3 to 4 times more than white women. Matter of fact, the data says that out of every 100,000 births, 50.3 of those are Black moms that are dying. And here's the deal. They are unnecessary deaths. Many of them are preventable. Greetings, greetings. This is Coach Charlene, and I want to invite you into this conversation that I'm going to have today. It's a courageous cultural conversation. And so I am going back to Black maternal health because this is so important. It is very dear to my heart because when I was leading, post-retirement, I worked in the maternal child space and perinatal services in particular. And so we got to see this firsthand about all of the data that we've heard about Black mortality. And I want to talk to you today about why moms are still dying in 2025. 12% of the population are Black moms, but we're still dying at a rate of 3 to 4 times more than white women. Matter of fact, the data says that out of every 100,000 births, 50.3 of those are Black moms that are dying. And here's the deal. They are unnecessary deaths. Many of them are preventable. And so what really hits different for me is no matter how much that I've fought through stereotypes to undo them. For instance, as a college student, I am at higher risk than a white woman without a high school diploma. So this ought not to be so. And so it doesn't matter how much education that I have. It doesn't matter if I am a multimillionaire or a high six-figure earner. It doesn't matter what my insurance is. It doesn't matter my title. My outcome is still worse than a white woman, 3 to 4 times worse. And so that's really what I wanted to dig into. And you know what? Here's the deal. It is not our bodies. It is the system that is failing us. And that's what I want to get clear to Black moms. It is not you. It's not something that's genetically altered, and that's why we're dying at greater rates. It is not that. It is the system that is failing us. It is the system of bias. It is the system of people not listening, not hearing, and that's dismissing symptoms, that's trying to tell you something about your body that you already know, that you're trying to explain. And so when we think about this whole topic, my goal today is to empower you to find your voice, to empower you to advocate for your health, because your health matters, your life matters. And so I want to also partner with those people that are with you, whether it be your spouse or a friend, to make sure that you speak up. So we're going to talk about, give you some tools and some scripts and things like that to help you out. And so one thing that I want to make sure that we know is that moms know their body. I mean, we know what's going on in our bodies. I just want to share really quick because, as a nurse, I had an opportunity to deliver, and I experienced this. That's why it is so raw for me, because I remember going into labor. This was my second child, my daughter, and I knew what was going on. I was there, I was in the delivery room, and my birth plan was that I wanted an epidural. That was my choice. That's what I wanted to make my experience great. And so the nurse was taking care of me. She actually had a student with her, and I was asking for the epidural. And I'm telling you, I asked over and over. I mean, it felt like I asked at least 50 times. Now, I may be exaggerating a little bit, but for a mom who is in pain, you're begging for relief. And so she would disappear, and then I wouldn't see her for an hour or something like that. I ring the call bell. I mean, she comes back. She's like, oh, okay, I'm going to get it. But it was like pulling teeth trying to get her to get me an epidural. And so at some point, I looked at my husband. I was so upset. I mean, he could see it in my face that, uh-oh, Charlene, because, I'm this loving, kind person, but I turned into this person that head was getting ready to spin around if I didn't get some relief. And so he said something about it. But, we're really kind individuals. So it's not like we try to, stir things up. We just wanted the appropriate care. And she finally came and she said, okay, anesthesia is coming. And you guys, I got the epidural, but do you know I delivered 30 minutes later? I was in agony for multiple hours. And yeah, we know that there's going to be pain during labor, but that's not the point. My point was, I know that I wanted an epidural. And she did not listen to me. She dismissed what I was telling her because she wanted to do her own agenda. So things like that is a problem. If a patient comes in and says, hey, I want this, I want that, we try to accommodate as much as we can. So the system actually creates the risk when we don't listen. Let's just think about the two recent viral videos that went. I think one was from Texas, and one was, I think it was Missouri or Minneapolis. I can't remember. But you know the two videos that were out. If you don't know, please go back and look them up, because these two moms were in active labor. They were, one in particular, I think they had her in a wheelchair, and she was in such agony. She was standing up. She was screaming. She was arching over. I mean, she had all of the signs. And the nurse was over at the computer with her back turned toward the patient, asking questions. I mean, she had no regard for humanity, no regard for this mom that was screaming, that was hollering, that was in agony, and lifting up. You can tell that she was crowning. And so she kept asking the questions. And let's not get it twisted. The questions need to be asked, but there's a way that they can be asked. And when there's a apparent delivery that's getting ready to happen, like right now, my responsibility as a nurse is to get you as comfortable as possible so that we can potentially deliver, like literally right there. We don't want to deliver right there in triage, but if we need to, we will. But there's things that could have been done so much differently. So I'm not even going to get into the clinical issues, because there were plenty of epic failures in that interaction with that patient. What I am going to pull out is how a nurse can turn your back on a patient and not listen. See, that was the part that really touched my heart, and that really bruised me in a way that I was like, okay, this is not okay. Because when I look at another individual in the face, I see humanity. So what happens to one happens to us all. So I'm a mirror, I'm a reflection of what's happening in that moment. And so these women that were ready to deliver were dismissed. They weren't, the interventions that should have happened did not happen. The one thankfully, there's some laws now being put in place from this one deliverer. So I really love that this woman went and got the news involved, got policy changes, all of those different things. But she was discharged, and they delivered in the car within 6 minutes. And so, not being heard, being dismissed, being told, oh, that's just how it's supposed to be. Well, you're in labor, you're going to have pain. All of those different type of statements that sometimes come out of healthcare workers' mouth. That was not the time for that. And so, the one I'm going to reiterate is turning your back and not listening, not comforting, not caring for. So anyway, we know that it was epic. They were epic system failure. So we can't create the risk within the system. We want to correct that. Now, first of all, I am not by any means provoking fear. I really hope you hear my heart. My heart is really just to educate, to empower, and really to urge you to make sure that you find your voice when you go to your appointments. When you hear something, I mean, when you feel something that's not right, that you're not brushed off. And so the second thing that I want to talk about is when you do go to your doctor's appointment, don't be afraid to ask your provider. That's supposed to be a two-way relationship. Make sure you're connecting with your provider, with your physician, with your midwife. Just make sure you're connecting because you want to build that relationship. You have a 9 months journey to be with a physician and you want to build trust. When you don't build trust, then you're suspicious and you're wondering and you're telling yourself stories in your head. So make sure you build that relationship. You know how it feels when someone is truly listening to you authentically. And so build that relationship. Ask those questions. Ask questions beyond the questions that you normally ask. I think also some important things that you want to ask when you're going to a facility, ask them what their C-section rate is. Like for instance, where I came from, our C-section rate was really low. It was really amazing, actually. And so you want to find a hospital that their C-section rate is lower because that means that they're just not going to cut at the drop of a dime. They're going to support you and try to, as much as they can, to help you to have a successful vaginal delivery if that's what you desire. But you can ask that. You can ask questions like, who will advocate for me if I can't advocate for myself? Will people really listen to me when I need to be listened to? What are your hemorrhage protocols? I mean, you're not going to say protocol, but what do you do if I began to start bleeding? Like, what are the steps? Those are just like little things that you can ask to make sure that you feel safe, in the event that you do have complications, because there are complications with birthing at times. And so just make sure that you ask all the questions that you can. Write the questions down. Begin to start. When you think of a question, write it down and make that connection with your provider so that you can have a really authentic communication, a two-way communication, not just the physician talking to you, you actually talking to them too. You have to find your voice. You have to learn how to advocate for your own health because that's your responsibility. And then the third thing that I want to talk about is those that are with you, your spouse, your friend, whoever it is. You want to make sure that you bring somebody to your appointments, because sometimes you might be a little intimidated. So talk it over with your spouse, with your friend, and just give them permission to help you take you to your appointments. Ask the hard questions that you don't want to ask. Um, Make sure you don't dismiss things that you know that are going on in your body. They can be there as a support and say, hey, don't you remember you told me that this is what you were feeling? Whatever it is that you're talking to your friend about, but don't go in fear. You go in power. You go in with, okay, this is what I'm feeling. I'd like to talk to you about this. These are the symptoms that I'm having. Please could we talk about this? Is this normal? So just that two-way communication, because that's what's extremely important for us, and that is communication. And so with that being said, I encourage you. You are the advocate for your own health. A lot of times, I don't know if you've heard, but if you're pregnant or thinking about being pregnant, most people, especially African Americans, women of color, are choosing to have doulas and choosing to have midwives. And there's nothing wrong with that. Sometimes people try to shame people for having that type of support. It's been shown in the research that if you have a doula or a midwife, that your outcomes are better. And it's because they have that sense, like that nursing sense, to really lean in and to hear what you're saying and to connect with you in a certain way. And they they deliver culturally competent care. And so when you say something, they're really leaning in and listening. And they can also tell you, hey, you're being a little bit, over the top. But it's a relationship. You build those relationships so that you can talk about the things that you need to talk about. So I hope that you were empowered to speak up, to find your voice, to share the things that you need to share with your provider. There's one thing that I want to add on to this conversation, and that is after you have the baby, it is just as important for you to pay attention to your body. A lot of times, women are dismissed because they're having all these different things going on in their body. And yes, your body was stretched out of source. You just delivered a baby, but there are specific signs that I want you to pay attention to. And most hospitals, and hopefully every hospital, will go over with their new mommy or multip about different signs of hemorrhage and things like that that they can have post delivery. And some of those things that I want you to think about, if you're having, you must say something about it. And that's shortness of breath. I remember when Serena Williams had her baby and she was complaining of shortness of breath and tightness in her chest and things like that because she knew her body. She was having a pulmonary embolism and she was trying to get them to clue into it, but they weren't listening to her. They were just kind of brushing off and say, oh, that's just what happens when you're pregnant. And so you need to cue in and so those things because that's not normal. Shortness of breath, chest pain, heavy bleeding. I have a friend that delivered and she went to check on something and she found herself just hemorrhaging right there at that point. And so that is not normal. So you need to go get checked ASAP. Extreme mood changes. Pay attention to what's going on or be open to hearing if someone's saying, hey, something is going on. You're a little moody, like a little bit more than normal. So I wanted to just share those things because just because the baby's here doesn't mean that you're out of the danger zone. You want to make sure that you are listening to your body from the beginning to the end and beyond. I'm talking about up until baby is at least 6 months to a year. So you need to pay attention for when your body is trying to tell you something and don't allow things to be brushed off. If you're having chest pain, if you're having shortness of breath, then you need to make sure that you advocate and you're firm with saying that you do have these problems going on and you need to make sure that you are doing well. So let's resolve this and let's work together and do that. And that's also some things that your partner or your spouse can do when they see that happening to help you advocate in that way if you can't do it for yourself. Okay? Now, thank you so much for watching. I hope that you gained some insight into pregnancy, postpartum, as you walk your journey. Birthing is a beautiful, amazing gift, and you get to see your future president, your future leader, your future homemaker, whatever that baby's gonna be, you get to usher this beautiful soul into the earth realm so that they can be all that you want them to be. But first, we want to make sure that you, as the baby carrier, are doing well. So thank you so much for listening and happy pregnancy to you.